Good morning, YouTube family and friends. Hope you had a great week. My week was busy with medical. Yeah, I got some updates for you folks. If you watched last week's videos, you know that I had Monday I had an ENT appointment. Wednesday I had my heart checks with an echo, a stress test, and put on a Holter monitor. Actually, that was Tuesday, not Wednesday. Sorry. Tuesday was that appointment. Then Thursday, I had my initial consultation with the neurologist to see if I get the official diagnosis of myasthenia gravis. So we'll touch all that in this video. Let me start by saying today is Saturday, July 20th, 2024, and this is my week 17 results being back on Mounjaro. But again, as the last few videos have been, it's going to focus more on just my health updates and all the fun stuff going on. So let's go ahead and get it started off. All right. On Monday, I went and did the ENT. I'm looking into getting the Inspire medical device. Uh, that's it gets implanted like right in your right chest area underneath the skin, and it replaces the CPAP. So for those of you who struggle using CPAP, this is an alternative. I've tried oral devices before that didn't work. Yeah, that's ugh, I don't want to touch that. I've tried different types of masks. I've done nose mask, small mask, full size mask, and yeah, right now it just doesn't work for me. You know, I do see improvement on using the CPAP machine. I do. So don't get me wrong. If you can tolerate wearing the mask, it's awesome. But for me, it leaks all the time. I have to sleep on my side and kind of put pressure on the mask so it doesn't leak. And I get irritation a lot on the corner of my eye because it leaks. It likes to leak right in here, and the air leaking shoots right into the corner of the eye. Of course, you can see some of the strap marks. So I have to wear it so tight to try to keep it from leaking. There's been nights where I've taken it off and not even realized I've taken it off because it was bothering me that bad. So yeah, I was looking into that Inspire, and my primary doctor says I meet all the requirements for her to be able to do it. So I had to do an ENT consultation to see if I meet the final requirements. ENT doctor talked to me about it, and he said that I do meet all the requirements, except for there's one final test he has to do, of course, and that's doing a scope of my throat to see how the airway collapses on me when I sleep. So what they would do is they would do a quick like 15-minute type of thing where I go into the hospital. They would put me to sleep using propofol, Michael J's lovely juice. And when they put me to sleep, they'll put a scope down through my up in my nose down to the beginning of the airway, and they'll monitor how it collapses. If it's like just the muscle and stuff collapsing onto the airway, then this device will help because the device will run a couple of wires up your neck underneath and connect it to like the tongue muscles and stuff back in there. And then when you go to sleep, you turn it on and it stimulates those muscles of your tongue. So it kind of makes your tongue move forward, which will keep all that from collapsing into the airway. If it collapses another way, like if the airway like squeezes instead of the stuff collapsing, blocking, if it squeezes to block it, then I don't qualify that way. But he said the majority of people have it where it's just the back of the tongue, muscles, and all that just when you lay down collapses and blocks the airway. Usually, most of the time, that's what's going on. But I did ask him, no, if I do get diagnosed with this myasthenia gravis, the autoimmune disease, how that would potentially affect me being qualified to get this device, and he said it doesn't. It doesn't affect it at all. But he did want me to discuss it with my neurologist if he does diagnose me with MG to discuss that with him, that I want to look into getting the Inspire device for my sleep apnea, and then let him know what they say. So I did discuss it with my neurologist on Thursday, and neurologist wants me to hold off on it for now. So let's just go ahead and talk quickly about it. I was diagnosed with myasthenia gravis, and it's not just the ocular; it is the more bad form of it. I'm diagnosed with generalized myasthenia gravis, tomato. That's scary. He did all kinds of muscle tests on me. No, we talked about my symptoms and what's been going on this year. And of course, my blood work came back being positive for the antibodies. And when he did my strength test, my arms and my legs were fine. I did talk about how my breathing is sometimes not labored or anything, but when I lay down, sometimes I feel like it's a chore to breathe. And then my tongue's been tingling lately. And I don't want to get into the details of this. I am going to start making blog videos about that and my journey with generalized myasthenia gravis. So I'll talk more into those videos. But just a long story short for this video is I do have it. I have the more bad form of it, which is the generalized myasthenia gravis. And my neurologist says he wants me to hold off on that Inspire sleep device for now. He says we need to focus on getting you under control, getting the symptoms under control, getting the treatment plan going for it. And I'll talk more about the treatment plan in the other video. I'll put out the other video on the other blog maybe later today or tomorrow, sometime this week, because I do have an appointment next Wednesday to do a CT scan on my chest, or some type of scan on my chest to check my thymus out. So that's next Wednesday. So, but I'll get more into that in the other video. So I was gonna message my ENT doctor yesterday, Friday, but as y'all know, around the world there was a cloud strike, did an upgrade that didn't go well and knocked a lot of people off the internet or off their systems. So, and my hospital was affected by it, so I could not get a message to my doctor, my ENT doctor, about what the neurologist said. So I'll do that this coming week. So there's the update on that. Cardiologist stuff on Tuesday. I had the echo, I had the stress test, and I got the Holter monitor put on. I got the results back for the echo and the stress test, and my heart's fine. It did confirm again, another confirmation that I do have bradycardia. My resting heart rate before doing the stress test was 45. And I didn't have any episodes being on the Holter monitor for 48 hours. I took it off on Thursday morning at 10 o'clock and before my neurologist appointment at 1:30. So I'm waiting for the results of the Holter monitor, but the echo and the stress test came back fine. My bradycardia and my fatigue, extreme tiredness is not being caused by the heart. So most likely my bradycardia is being caused by me having hypothyroidism, which could also hypothyroid, any type of thyroid issues could be a side effect of myasthenia gravis. So, but yeah, the Holter monitor, oh my God, they scrape you with like sandpaper in several spots. I'm gonna take my shirt off, folks. I gotta take it off anyway to do my Mounjaro shot. So, but I'm gonna show you this stuff. It still hurts. So as you can see, the red mark here, the red marks here. I got bald spots. Oh, pulling that tape off. Oh my God, that hurt. Another spot was over here. Because they scrape it. It's like sandpaper. They scrape it. And then another spot was over here. But yeah, they're still sore and tender. They're healing up. But man, that hurt. Oh my God. Scraping with the sandpaper before they put the monitors on, the little wire ports to monitor. Oh man. So, okay. So what I'm going to do for the rest of this video is I'm going to check my blood. I want to see where my blood is at. I am going to ask my primary doctor this coming week, now that I am officially diagnosed with the generalized myasthenia gravis. I want to go up on Mounjaro because I am struggling with eating. Uh, I'm worried with the weight gain that my blood sugar is going to go out of control. And potential medications for the MG could affect my diabetes and weight gain. So I am going to ask my primary doctor if she'll move me up to the next level. Right now I'm just on the lowest dose of Mounjaro of 2.5. I'm going to ask her to go up to 5.0, the next level of dosage. So anyway, let's go ahead and check my blood right now. I got my monitor test strip and my alcohol wipe. So let's go ahead and do this. So open up my alcohol wipe. I've been using my middle finger lately, so let's use the finger right next to it. Give my middle finger a break. Alright, so there's that. Gotta get the blood flow to it to make sure blood comes out. Alright, gonna put my test strip in. There's that beep. Alright, do this again, the fun part. Ouch, I hate that part. Blood, yay. Alright. Alright, and I just ate breakfast, so I'm gonna do it after meal test. And ooh, 154. I just ate like a few minutes ago. I had a cinnamon and raisin biscuit, or bagel, not biscuit, bagel, cinnamon raisin bagel with peanut butter spread on it and a banana cut up on top of it. Wow. Now I wish I would have checked it before I ate, but I needed to eat to take the new medication. I'll talk about that in my other blog for my myasthenia gravis. But I needed to eat for that. So, wow, 154. I'm gonna start checking it more often, folks. I will do that. Start checking it more often. All right, now for my Mounjaro shot, 2.5. All right, for those of you who've never seen it before, comes with the cap. Take the cap off. Needles inside of it. It's in lock position. You want to move it down to the unlocked position. And what you do is you want to shoot it in your fat area around your midsection. It has to be at least 2 inches away from your belly button. I still got the bruise from last week's shot. I bruised last week. And I did bleed a little bit last week, so that makes sense. I hit something. I hit a small blood vessel and I bled. So it makes sense that I still got bruising there. You can do it on the fat part of your arm or in your thigh where your fat's on the side. I like to do it in my gut. So I'm going to do it on this side. I just came out of the shower, so I know I'm clean. So let's go ahead and do it here. You see the needle in there, so you'll push down on the button, and you hear it click, and you watch the needle go in, and as soon as the needle is done giving the medicine, it will retract, and you hear a second click, and that's when you know it's done. So here we go. All right, second click. I saw the needle retract. It's done. No blood this time, yay. But there is a little bit of medicine on it, so that sucks. Alright, so some of the medicine didn't go in, but it was just a little drop, so it happens sometimes. Alright, folks, that's what I got for you this week. Stay tuned for my other new vlog videos dealing directly with my generalized myasthenia gravis. And I'll provide all my updates and more detailed discussion on those videos. I will continue to do small updates on it on these weekly Mounjaro videos, but I'm gonna do more discussion on the other videos. So that's what I got for you this week. Have a great weekend. Remember to enjoy life. You never know what life's going to throw at you. I'm living proof. You know, just love life, love your family, love your friends. Tell everyone you love them, and yeah, just enjoy life. So, all right, that's all I got for you. Have a good one. Sorry, folks. I was watching my video before I posted it, and I realized I never gave you my actual week 17 results being back on Mounjaro. My mind, brain fog, whatever you want to blame, I don't know. But anyway, quick results. I weighed in this morning. I'm still at 230, so it's nothing spectacular. It's zero. I've been weighing in at 230 the last 2 weeks, so this three weeks in a row, I believe. Been weighing in at 230 with no change to my weight. So there you have it. For week through 17 weeks, I've lost a total of 6 pounds being back on Mounjaro. But again, a lot of this is I'm not exercising. I get tired after work with this NG stuff. So yeah, and I had not been eating good, so I need to figure out a way. I've been stressed. I've been stressed a lot, and when I stress eat. I'm a stress eater, especially with the sweets, and I've been eating sweets, and I'm shocked that I'm not gaining weight. But at least I'm not gaining. But yeah, so there it is. Week 17 result is a 0, so I'm still at 230. All right, have a good one, folks.